Hi nurses, once again continuing the topic of Nclex where I talked about SATA versus priority. SATA means select all that apply and priority based question means only one answer will be there that you have to choose the priority. Today we'll talk about a very special topic heparin and इस topic से आपको पता लगेगा why we produce so many good results of Nclex. हेपरिन इज एंटी कोएगुलेंट, हम सबको पता है हेपरिन इज एंटी कोएगुलेंट, दैट मीन्स एंटी टू कोएगुलेशन, कोएगुलेशन मीन्स क्लोट. So that is how we make your things simple. Heparin anticoagulant, that means it will prevent the clot formation. Simple. Second important thing is what is the usage? Where do we use heparin? Remember it, DVT, PE, AT. DVT means deep vein thrombosis, PE pulmonary embolism, AT means atrial fibrillation. Three usage majorly. Then you go to the next thing, that what is, how do you monitor the lab value? This is a very important point because on this point the question comes in Nclex exam. That is known as activated partial thromboplastin time. So APTT is all about time. Normally APTT value is 30 to 40 seconds, but when we introduce heparin to a patient, this APTT value reaches to 40 to 80 seconds. And it becomes fatal or lethal or dangerous or noticeable when it reaches to 100 seconds. So APTT is about time. So how do we monitor the lab value in case of heparin is APTT, activated partial thromboplastin time. That means thromboplastin means clot formation timing. So heparin देने के बाद obviously when we will give heparin which is an anticoagulant, timing will increase. This is how you remember. That is how we boost your fundamentals over here. Now the next thing comes is side effects. That suppose there is an overdosage of heparin. How do you monitor the side effects? So bleeding in gums, there would be bruising, then there would be blood in urine, there would be tacky stools which is known as black tarry stool, which is also known as melena, and it can also lead to heparin induced thrombocytopenia in which the platelet count will decrease significantly. But observable factors are again what I talked about: blood in urine, bleeding gums, then there was black tarry stool and bruising. These are the major things. So on this topic, this is how would a nurse get to know about that heparin has been given in overdose. So you have to monitor. So that is how the kind of questions which will come, that how would a nurse observe, what would be the signs if there would be an overdosage. Now comes what to do. If there is an overdosage, then there would be an antidote. Antidote is protamine sulfate. In case of heparin dosage overdose, protamine sulfate is antidote which is used in severe bleeding or in heparin overdosage. Protamine sulfate is very important as well. So again we will talk about it's like 50 mg in 10 minutes, but that is, this kind of question will not come in the exam. So that is where we restrict you from knowing over, because you can't learn everything. So we need to understand what kind of topics come in Nclex exam. Now comes how to give this heparin. It is given subcutaneously, just like this syringe you must have seen in your homes with your grandparents. This is just like the similar as subcutaneous diabetic syringe. So heparin is given through this subcutaneously in umbilical area, 2 inches around the umbilical, and you have to keep rotating the stride. Sometimes you will place it on the right, sometimes on the left. So that is how you take this heparin, and you don't have to rub it. This is also one of the important questions that can come in Nclex exam, that if you rub the area, it will destroy the blood vessels around umbilicus because you have given heparin. So never rub the area. Then don't aspirate the syringe. Never aspirate the syringe in these kind of subcutaneous injections. You don't aspirate, and you have to keep rotating. Now I will talk about how the questions comes. Like suppose if a patient has been given an overdosage of heparin, how would a nurse react to it? Nurse कैसे react करेगी? So 4 options would be given, like stop heparin immediately. She will inform the healthcare provider, HCP. Now in India we think healthcare provider means below the nurses, below the doctors, but in English countries healthcare providers also include doctors. So this is what we teach you here, that doctors are also known as healthcare providers. So it is important to inform in case of overbleeding. In case of bleeding due to heparin overdosage, you will inform HCP, you will stop the heparin, you will give the protamine sulfate. So these come under select all that options, SATA question. So you will select all these 3 options. But if it is a priority based question, see here is the trick. If it is a priority based question, then you can select only one thing. That means what is the priority. So all the 3 options will be given: stop heparin immediately, inform the HCP, protamine sulfate. So the option will become stop heparin immediately. This is the priority. So in priority based question, only one option will be your answer, that is stop heparin. So this is what is the difference. I will give you one more example of a priority based question. A patient receiving IV heparin suddenly reports severe back pain and hypotension is noticed. What is the priority nursing action? Continue the infusion, stop the heparin immediately, give oral fluids, check blood glucose. Obviously we all know stop the heparin immediately, because severe back pain plus hypotension is a sign of retroperitoneal bleeding, and first priority action would be to stop the infusion immediately. Now we learn from this video that in all the cases when we are giving a drug and there is a sign of overdosage, stop the drug immediately. That is the first course of action as a priority for a nurse. This is how we crack Nclex. This is how we teach our students. This is how our mentors guide the students, and that is how we produce such phenomenal results of Nclex. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you for joining. Subscribe the channel and share this video with all your friends who are thinking about Nclex. And from basics to the most advanced, we will discuss all the questions and everything with you. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you.